And then last but not least, we have Mieke Moerman. She will tell us a little bit more about our solution to develop a medical. They developed a medically certified tool for remote speech language therapy. It's called TelePHON. Am I telephone?
.digital.
.digital.
Yeah, I know.
All right.
It's a difficult name.
It's
I know.
it's okay. Mieke, your time to shine.
Thank you very much. I hope I will. Good afternoon. I am Mieke Moerman. I am an ENT, phoniatrician, head and neck surgeon and speech-language pathologist, and I have been working for 30 years in an academical and a private practice. And during that period, I have been confronted daily with patients, with people with communication and swallowing problems, and with their social inability because of that. We all have experienced what it is to be socially isolated because of COVID-19, but imagine that this would last your entire lifetime. This man is a patient of mine, and he has suffered from an oral cancer, and because of his treatment, he was not able to speak, to eat and to drink anymore, and he even needed a cannula for breathing. So this man does not have a social life at all anymore. This social life was destroyed. And he's not alone. Yearly, we have over 38,000 new cases of stroke, head and neck cancer and Parkinson's disease in our country. Next to that, half of our population over 65 years or older suffers from communication or swallowing problems to some extent. And for your information, now 1/5 of our population is older than 65 years, but that figure increases towards half up to 2050. Why developing a digital tool for helping these people? What are the needs? Actually, the patients need more access, easy access to care. They want to work independently from the therapist's agenda and without any transportation cost and time. Therapists seek care continuity. They want to optimize their working time, saying less administrative time, less administrative burden, and they want to give care in a multidisciplinary setting. Hospitals, on the other hand, seek for shorter admission times. And that can be done by intensifying exercising within the hospital borders, and that leads then to less complication ratios. Next to that, hospitals are looking for an optimal continuation of care beyond their borders. TelePHON.digital is a medically certified software as a service for speech-language pathology. We deliver continuous, qualitative and evidence-based care, personalized guidance and insight in outcome measures. How do we do that? We are an all-in-one tool with a generic structure. Our spine structure is available in various languages, and the content can be uploaded into a public or a private library. The logbook provides insight in therapy compliance and patients' performances. And our safe and secure video consultation mode allows one-to-one coaching and supports blended therapy. Our market is multi-sided. On the one hand, we have the therapeutic side, which comprises patients, hospitals and therapists. And on the other hand, we have the preventive side, which comprises actual individuals who are in doubt whether they need care or not, whether they have a problem or not. TelePHON.digital offers for therapists a digital means to deliver and follow up therapy more efficiently. To the patient, insight in their progression and active participation in the therapy plan. To individuals, a real clear defining of their needs for actual care. And for the hospital, an optimized care path. Our target market in Belgium exists out of 9,600 speech-language pathologists, over 500,000 patients, 1.8 million voice professionals, individuals, non-patients, and 103 hospitals. Currently, we are handling a fee of 408 euros for a yearly license, 39.99 one-time fee, setup fee for individuals, and 5,000 a year for hospitals, depending on the size. We approach the therapists through professional societies, colleges, and direct contacts, and the patients' individuals through patient societies, sick funds, general practitioners, and the hospitals through our network. The differentiation with our direct and indirect competitors lies in our medical certification. We are now M1 in the M1 level approved, the quality content, and the network of the founders and our advisors. Our team concurs with 5 full-time equivalents, and our co-founder, Tom Steeland, who is a speech-language therapist, is also an expert in his field. Next to that, and quite recently, 2 men who possess really in-depth knowledge of the e-health ecosystem in Belgium and who have also a large international network, agreed to enter our advisory board. We want to achieve a stable position in Belgium within 1 year, and the momentum is there, given the upcoming quality law and the governmental goals written down in the e-health action plan. Next to that, we are making now our first moves towards internationalization by launching a clinical trial in Germany to enter the DIGA fast track. TelePHON.digital is our first product from our company. Together with ARTVA, a web-based acoustic algorithm, and the voice visualizer, an easy access visualization hardware, we want to evolve by means of AI towards clinical decision supporting algorithms. The current financial plan predicts a customer acquisition cost of 21, the average revenue per use of 92, and a lifetime value of 92. To make this all happen, we need 450k now for operational businesses and 650k in medium term to expand our adjacent businesses. Thank you for your attention.
Thank you, Mieke, and I really enjoyed it. Over to the experts. Pascal.
Thanks, Mieke. You know that I believe in the concept from the beginning because you work value-based. It's better experience for the patient, it's better outcome, and it's for reduced cost. So the concept is great. What struggles me is why you're not yet level 2 in the mHealth. Well, what's the difficulty? Because, and I'm asking it not only to ask why not level 2, and what is then the relationship with the data platforms of hospitals, because it's an extra tool, it's very specific, how you integrate it, where is the data, you know all the problems, and what is the relationship with not being yet interoperable on level 2 of the mHealth?
This is a very hot item for us right now, and we are...
I didn't know, huh?
Sorry?
I didn't know that. Huh?
No, we are working on that right now. And one of our advisors is very well acquainted with hospital structures and so on. He is also involved in the COSO platform. So he will help us a lot. The other advisor also has great connections to help us with that. We already talked with some people of the RISIF to define the technical details. So we are really very close to that M2
okay,
level.
It was not from the beginning, but you're taking actions within the group to correct that. Okay.
We aim at mid-2021 to be fully compliant with the M2 level.
Thank you.
Okay. Tom?
A question on the digital resistance something we've discussed before. But how do you think you can overcome that resistance with speech therapists on digital tools, not only teleconsultation, but also patients practicing by themselves without the involvement of the speech therapist?
Yeah, thank you for that question. Indeed, speech therapists are quite conservative in digital health, and they define digital health often as simply video consultations. We want to do more. We really want to follow up the therapy, the compliance and the outcomes. And we need a mind shift for that in that specific population. And I think the best way to do that, just correct me if I'm wrong, but the best way to do that is actually to use a patient as an ambassador towards your therapist. When we can convince the patient of the benefit of a digital tool with which he has insight in his own progression and in which he can participate, then he will go to his therapist and tell the therapist, why don't you use TelePHON.digital? That's a good tool, it's nice. And now we already have a partnership with one of the sick funds to communicate, first step in the partnerships, to communicate the existence of TelePHON.digital towards their members. And that is the beginning, that's a starting channel to approach these patients specifically and then to have the loop towards the therapists.
Okay, thank you.
Okay, Wouter?
Yes, perhaps a question with regard to the internationalization. So Germany, it's quite obvious why you made that choice. Whether it's the right choice, it's a difficult market. It's without any doubt, that I leave. But what I want to understand is exactly how much extra effort would you need per language?
Yeah, okay. Yeah, that's a nice question. Yeah, it's a speech pathology tool, so it's an obvious question. But the trick is that we have a spine structure available in various languages already right now. Dutch, French, English, German, Spanish, Catalan and Italian. And then we count on therapists and medical doctors, colleagues of mine, to upload language-specific content. Some things can be translated very simply. A validation questionnaire, a quality of life questionnaire which is validated is available in various languages. But then we have language-specific exercises in speech therapy which need to be uploaded by the therapist of that country, of that language themselves. Next to that, speech therapy has also a non-language related flow. Voice, for instance, swallowing, for instance, is not quite language related. So these are tools or exercises which can easily be offered to various patients in various countries.
Okay. Catherine, last question of the day.
Very last question. Okay, so you're looking for investment. If you would be going for venture capital, then of course most funds have a limited time frame. So they will be looking for an exit in, 5, 6, 7 years from now. What do you see as potential possibilities, or maybe where are you dreaming? What are you dreaming about personally, kind of to leave the company, or where do you see it on the medium to long term going?
Well, I can answer very broadly on that question. I will start with beginning. For what it's worth, in a real startup, because we only exist for 1.5 years, we have since 1st of January 2021, we have a tenfold growth compared to last year. For what it's worth, in a very starting startup. Next to that, we have made calculations for the Belgian market only at this point, and we already have a growth of 4 to 5 within 5 years. But that's only for the Belgian market. So when you count surplus on that, the same curve, then I think there is a huge potential in that. Next thing I wanted to communicate to you is my personal ambitions, and you can see that my gray hair. I do not seek to be the CEO of this company. I have my medical expertise and I want to do that. I want to do things where I'm good at. So the operational and the CEO businesses, I really want to give that out of hands within due time. Yeah? And then my personal exit strategy would be, which I dream of, to leave the company, a flourishing company, within 8 or 10 years.
Okay.
Fantastic. Wow. Mieke, I'm truly impressed and
Thank you.
giving a little bit silent of your speech and your dreams and the way you do it. And yeah, you're a fantastic entrepreneur, CEO, and it's a beautiful product. And what you achieved in 1.5 years, I think it's truly impressive. So
Thank you.
I hope
Thank you
you're
very much.
partially as proud as I can be here from
Thanks.
the other side of the street. Congratulations. All right, everyone at home, this was already our last pitch, unfortunately. It was the 5th session, the session on health tech. As I mentioned earlier, at 4 p.m. we will start our one-on-one meetings. It's via the conversation starter tool. It's really easy to manage your agenda. So if you didn't book them yet, go on the tool, schedule some meetings with the pitchers, with the experts, with myself if you would like. Tons of opportunities. Last but not least, I really want to thank all the experts. I think it was, again, a very broad range of expertise. Thank you for your time. Thank you for sharing it. Thank you also to all the pitchers. Great added value. And thank you, of course, as well to all our partners who make these events in these crazy Corona times possible. It's the City of Ghent, Blue Health Innovation Center, Flanders Health, Orsi Academy, Vlaio, Ban Vlaanderen, Bitstream, 4M5, MT Magazine, and PwC. Last but not least, we from startups.be, scaleups.eu, we organize a lot of other events as well, and we would love to welcome you May 5th on the session on HR Tech, May 11th at the Big Squeeze for some knowledge transfer and networking, and May 18th for the Go Global on to Berlin on healthcare. The Go Global to Berlin is, of course, a virtual event as well, but I think it will really help you to connect with potential investor, potential partners. So make sure to go to the website, and we hope to welcome you soon at our upcoming events. Looking to the crew, anything I forgot to say? Okay, then thank you very much for joining us. Thank you, everyone, and I hope we can connect during the one-on-one meetings.